The preliminary studies reveal that we have traces of lead, cadmium, and other heavy metals in the water and in some of the vegetables, grown here. And you see, most of these vegetables, they are not even they are taken without being processed. Take, for instance, cabbage and then fruits.
From the investigation, we were able to see that there are hotspots, especially this community, Yobe, Jakusko and Bede local government. We have a lot of people coming from those one. In Borno State, we've got a contrary one in southern part of Borno, in Askira Uba, as well as Haul local government, which is a rocky terrain. We also found hotspots in Hadejia.
Welcome back. This is still the morning brief on Channels Television. And now we turn our attention as we continue in the health sector, but this time to a killer disease, which for some it is slowly, and for others, if you do not find it early, it's just like a death sentence. It's kidney disease, which is now prevalent in northern Yobe. It's in Yobe State, but it's been found that the most cases are in northern Yobe. And we have heard there from stakeholders saying that they have found lead in water, but some other sources can lead to kidney disease. There are other factors that can lead to it. And there's also research on what the outcome of this research or findings will be. We'll have stakeholders talk about that on the program today. And via Zoom, joining us on the program is Chief Medical Director, Yobe State University Teaching Hospital in Damaturu, Dr. Baba Waru Goni. We also have Dr. Mahmoud Meinabuka, who's the Honorary Special Advisor to Yobe State Governor on Science, Research and Innovation. He's the team lead founder by Medical Research, a Science Research and Training Center, Yobe State University in Damaturu. Thank you very much for joining us, gentlemen, on the program.
Thank you.
So let me start with you. All right, let me start with you, Dr. Gune. We've heard there about lead poisoning in water and other things, but you are there, you have firsthand experience and information about what is actually going on, the issue on ground, the numbers. Speak to us about what is going on at the moment and how this was even discovered.
Thank you very much. What happened is we found out that, we've been seeing excesses of chronic kidney failure, especially coming from communities along the fringes of the River Yobe. Which is a continuation of the, Hadejia Jamara River, which is one of the tributaries of the Lake Chad. We noticed that there are a lot of people coming from those communities with chronic kidney failure. And various preliminary work has been done by different researchers, especially on the water and soil in such communities. And that as Professor Maimuna Waziri, the Vice Chancellor of the Federal Investigation had alluded to, most of these usually heavy metals, usually lead and cadmium, were found to be excessively high, beyond the acceptable level by the World Health Organization. But these were different researches. So the next thing is to link this thing to humans, look at the levels of these metals in human beings and then do some environmental assessment also. But in the interim, the Yobe State government has for the past 7 years has been, rendering free hemodialysis services for people who are having chronic renal failure. At the moment, at our facility, we do about 600 sessions of free hemodialysis every month, courtesy of the Yobe State government. His Excellency Honorable Malabuni has recently even reviewed upwards the monthly standing payment because of the inflationary trend in the country. Apart from that, also, along with Dr. Maina, we're also going to collaborate with international, reputable scientists to look at both the remote and the immediate cause of this prevalent kidney failure in those communities. We've also been to Egypt, Arab Republic of Egypt, a few years ago, to Urology and Nephrology Center in Mansoura, which was one of the first centers in the Middle East and Africa to start kidney transplants, and with a view of training our doctors here to commence kidney transplant. Because, kidney disease is it's a very expensive disease. Dialysis is an entry measure, though people can live on dialysis for as long as possible. but at the end you need to, if the person has an end-stage kidney disease, he needs to have kidney transplant. And at the moment, a lot of people cannot afford those services. So that's why His Excellency, the Executive Governor of Yobe State, sent a high-powered delegation to Egypt with a view of going into MOU so that these services can be brought to the doorstep of our people here in Yobe State. Thank you.
All right, Dr. Buka, let me go to you. You are in government. I mean, you were working as a special advisor on Yobe, to Yobe Governor on Science, Research and Innovation, which means that you also know firsthand what infrastructure is like in that part of northern Yobe where this has become prevalent. What is the structure in terms of providing boreholes or potable water in that region?
Thank you very much for having me. I'd like to respond by reversing to the earlier statement that you mentioned about lead and other things. Because when there is a problem, the scientific approach to solving that problem first has to be going deeper to investigate the different hypotheses on ground. So at the moment, we know that there is the issue about heavy metals in the water and perhaps the soil, but we have to also take note of other potential causes for this condition, because in the world right now, over 850 million people are affected by kidney-related diseases. So there could be other factors. And in this research that Dr. Goni did mention, what we are going to be doing is to extensively gather environmental data, perhaps genetic data, as well as lifestyle data that can allow us now to connect the different dots together. This will now allow us to say, for example, could it be primarily due to heavy metal poisoning in the water, which might now allow us to make recommendations for policy or public health interventions, or could it be something entirely different? So this is why I am a bit hesitant at this moment to say whether boreholes, what should be done to boreholes, or that we have to first get the full research data and then make informed decision based on it.
Doctor, let me stay with you on this one. The dialysis, according to what I've read, is about 50,000 naira per session. Correct me if I'm wrong. And these poor people are coming in. Yobe is one of the poorest states in Nigeria. In fact, the third most dependent state on IGR, on FAC. It's one of the numbers don't look good in terms of fiscal performance for whatever reason. So this is supposed to be something that literally should be in a state of emergency. Besides these scientific processes you're conducting to find out further root causes, what behavioral changes are you advising the people? Because they say prevention is better than cure, which is why I started from the fact of how poor the state is. So that is a dilemma on its own based on the data we have. What behavioral changes are you advising the people so that they don't even, is it that they should stop drinking the water, or water supply is quite different? Anne has talked about borehole. What exactly are you advising to even the people that have not caught up this disease, God forbid, not to get it in the first place?
Well, if you look at kidney disease worldwide, we are now experiencing an epidemiologic transition, particularly in low and middle income countries like sub-Saharan Africa. Worldwide, the commonest cause of chronic kidney failure, usually diabetes, hypertension, and then a chronic infection of the kidney, which is referred to in the medical, balance as chronic glomerulonephritis. So, by and large, the messages are that people should go for checkup because, it's a very silent disease. By the time it becomes manifest, a lot of functions of the kidney must have gone by then. So, regular checkup of blood pressure, blood sugar, exercise, smoking should be quitted, and so on and so forth. When it comes to the water, at the moment, there is no conclusive research at the moment linking the two. But as I had alluded to earlier, preliminary works have shown that, there are heavy metals in the area. In case, research, is able to pinpoint that, environmental toxins are responsible, then, recommendation will now be made about how you go about removing those toxins, either from the water or from the food chain. And there are various methods to that, which is too early at the moment to speculate. But generally, when it comes to, lifestyle changes, kidney disease is like any other what we are getting is excess of the normal. Generally, the trend in developing countries, most of these non-communicable diseases are at the moment on the increase, perhaps due to sedentary
Doctor, my apologies, doctor. The reason I'm asking this question, that's why I started from an economic point of view. Yobe started 2022 in a whole year. They didn't make up the 10 billion naira, 10 billion as the IGR. So without fact, they can't survive. And I'm repeating that just to posit how bad the financial situation is. I don't know what it is now, but these are the records we have available to us. So if you say it's out of the normal, I expect some maybe out of the normal response beyond what we're seeing for the sake of the poor people.
Sorry, it's all about prioritization. If Yobe is on the where in terms of IGR we are at the lower level, but the state government is prioritizing the health of its citizens. That's why for the past 7 years, even during the COVID-19 pandemic, the state government had never stopped free dialysis for even a day in the state. And I'm just talking, this is just one aspect. If you look at the other aspect of the health sector, there are a lot of tremendous development that were achieved. So it's not the amount of money that you have that will determine what you offer to your citizens. It's your commitment and prioritization of the importance of their health. Yobe State has won even accolades in terms of the state that must improve state immunization, in primary health care and so on and so forth. We have 178 wards in the state. At the moment, the state government has constructed more than 140 functional primary health care, in all the political wards. So almost 80% of the wards are covered. And these are functional. We're offering services. The state health insurance is now, even into the non-formal sector, in which a lot of our citizens are now accessing healthcare, without undergoing catastrophic financial difficulties. So it's all about prioritizing, the welfare of your citizens above and all. I'm not we're not comparing ourselves with the big, boys in terms of IGR and so on and so forth. But I think our state government is prioritizing the health and welfare of the citizens.
All right, Dr. Yes, go ahead.
On that, I completely agree with my brother and the CMD, Dr. Goni, because I think it's all about prioritization of the citizens and also building something that is going to offer long-term solutions. So in the research sphere, for example, 3 years ago, with the backing of the state government, His Excellency Honorable Memala Buni, we established a state-of-the-art research center, which has some of the best equipment in Nigeria. For example, we have 2 confocal microscopes that are not to be found in any place in Nigeria. For the last 3 years, we have been training people on how to utilize these resources to start addressing local problems, because this is part of the long term. And so if you now look at the issue of the IGR being low, and then you compare it to the investment being made, you will see that the steps being taken are bold in terms of trying to address local solutions through research that can offer long-term solution to the people.
All right, Dr. Buka, let me continue with you on this one. We've talked about management. I'm sure my colleague, when he was asking about managing this and letting people know, oh, this disease is out there, what is the government doing in terms of awareness and campaigns? Also letting people know the real reason why they should be cautious, especially at this moment, knowing that it is on the rise in Northern Yobe especially. And when you talk about research also, what are you doing to hasten the idea? We know you talked about lead not being maybe not the main factor causing this right now. So it means that there are many other factors that can cause kidney disease. So how impactful would your research be in hastening it to know the actual cause and what is going on? So if it is water, then you know how to address it in that part of the country. So these are 2 questions talking about awareness and how your research will impact solving this problem in that part of the country.
All right, so let me just make it clear. I did not say that it's probably not the water, but rather when we are doing a scientific investigation, we have to come with an open mind, which means that we look at the water, we look at the soil, we look at genetics, we look at so many different things in order to arrive at a solution. And this issue has been going on for quite a while. Last year, I led His Excellency and his delegation to the United Kingdom, where We visited institutions like the Crick Institute, London, London School of Hygiene and Tropical Medicine, University of York, University of Sussex, and other places, where we had a meeting with some of the best scientists working on kidney diseases. And as part of that, we now formed a working group or a research team, which led to a work that Dr. Goni was talking about that enabled us to look at different kind of states, Jigawa, Yobe, and Borno, and allowed us to now look at, see the hotspots. Now, based on this research, it enabled us to now suggest that the next phase is population studies, where we now try to look at, for example, the extent and the prevalence of the problem, assess the risk factors, and this will now involve us looking at collecting water sample, soil sample, food chain sample, blood samples, as well as to look at the genetics that will allow us now to compare everything together to make a kind of arrive at a conclusion. But I have to say that research is a time-consuming process. It requires patience, and this is just the beginning of the solution. And I'll give you an example. If you look at it, for example, we have so many different diseases, let's say Alzheimer's disease, that has been discovered over 100 years ago, and we still don't have a solution. Because of what? Because it requires time. And in this situation, we are saying that we have started working on a solution, which hopefully within a year, we might have an answer. But it may also take us longer than that time. And we are so happy that there is a commitment from the government to ensure that the research, yields a good result and it continues to address the problems of the people. And in terms of awareness, there has been many awareness, and I'm pretty sure my colleagues here and they might probably say more about that. But already, this is why we went to the Bade Emirate to see His Royal Highness the Emir of Bade to give him an update about our preliminary data and research that is now going to start in order to seek community support, and also for His Emirate to become aware of what is to come in trying to find a solution to the problem.
I'll stay with you just momentarily. I'll stay with you. I think both of you provide a very interesting perspective. You can give us also government drive towards this, as well as the medical and research angle. I'm still saying with Dr. Maina Bukar, and then before I come to Dr. Warugoni. But Dr. Maina Bukar, speak to us about this, the prevalence. I need us to reestablish the prevalence. For a lot of people, there's a tendency to think, oh, it's not a big deal. It doesn't concern me, until it concerns them. So speak to us about the figures, the data that you have on ground. I know people have been posting on social media, doing videos, mourning and all that. But what have you found so far in terms of prevalence, the figures?
So at least based on the preliminary data that is currently being peer reviewed, we found that in 100,000 people, about 11 have this condition in body, for example. And if we go to, let's say, Askira Oba, that is about 6 in 100,000, and Jigawa, I believe, is about 5. But I have to caution you here. Our work focuses on looking at the patients that have been admitted to the dialysis unit in these different locations, Jigawa, Yobe, and Borno. So this is why now we need to go into population studies, where we are going to assess the situation at the population level to arrive at the more accurate estimate of the problem.
All right. And you referenced Alzheimer's earlier on, saying this has been discovered decades ago. But the tricky part is for Alzheimer's, the cause is quite complex, even to date. We're not quite sure about the cause. Even treatment is very tricky as well. But for kidney disease, it's preventable. And we heard the prof earlier on saying that, preliminary findings point to possibilities of cadmium, very dangerous materials, lead, either in the water or in the fruits. And they're not even processed just yet. These are things that are harvested and eaten straight up. So let me come to Dr. Warugoni on this one and just speak to, first, this is preventable clearly, and a lot of people are saying stay off water, stay off some of those foods that you've been taking. Is that something that is backed scientifically and something that is being put out there so people can maybe stay safe for this period while you find the real cause, and then we can know what to do? I know Jeffrey spoke to that earlier on. Dr. Warugoni.
Well, you at the risk of being an alarmist, you don't close your mind when you come to research. You want to look at all the possibilities. At the moment, if, for example, what about if you?
All right. Well, we'll come back to you later, but let's go to Dr. Maina Bukar while we try to resolve that. And I know you want to say something to that, Dr. Maina Bukar, but Jeffrey, Anne, you can take it up now.
All right, so let's stay with Dr. Maina on this particular one. Doctor, let's begin to walk to the future. Kind of asked questions about prevalence in the first place, and you've listed a couple of things in terms of prevalence. Going forward as a government, how long more do you think the government can cope with a high burden in terms of cost? I know both of you have mentioned the issue of priority, but it's a long-term journey. If they can find transplant, and even when they do a transplant, for instance, for those who are already victims, maintenance and all of that, what is a long-term game for those who government is supporting at the end? And how long is this going to be?
All right. This is a very good question. And you rightly mentioned that, transplant, and even the dialysis that is being done, these are all palliative solutions. They are also realistically probably unsustainable, because what you really want to do is to address the problem even before it starts, or we want to arrive at a time when we can even start to make predictions. But we are fortunate that in the Yobe state government, His Excellency is really, really into supporting research. Like I mentioned earlier on, in addition to having a state-of-the-art biomedical research and training center, which are some of the equipment that no any other place has in the country, or the government is also investing very, very heavily on building local capacity. So now this center that we have established, the idea is to be able to have an infrastructure that can allow us to train researchers to begin to address problems, not just kidney disease, but also all other problems, in such a way that we don't have to go out of the country to address those things. So in the last 3 years, the government, for example, has allowed us to train over 450 people in different areas in the biomedical science space. They have also built a center that we will be moving into by the end of the year that will allow us to move all this equipment and the new equipment that are coming in. So as part of the long-term solution, therefore, we are looking at two things. We are looking at going into deepening understanding of this kidney-related problem that will allow us to arrive at evidence-based solution that can allow the government to either make policy recommendations on what to do and not, and also maybe public health interventions, and maybe also we may arrive at a conclusion where lifestyle changes need to be changed. But importantly, also the capacity that we will continue to build at that state-of-the-art center will allow our researchers going into the future to be able to kind of understand these issues and even make predictions. For example, this year we had an artificial intelligence workshop in the center where people were trained on how to use AI in, for example, increasing efficacy in their research, in their training. And this AI, we want to continue kind of training people on how to use it to make predictions, because it's part of the future. In the future, we might end up saying, you know what, this society or this particular local government might end up having this and this because of X and Y that they have. And therefore, based on this, we have to start making X and Y interventions. And this is the future that we are looking at.
All right. Quite interesting, really. Let me come back to Dr. Warugoni now and get him to land on the thoughts, your reactions, and then, of course, if you want to speak to the point raised about the way forward, Dr. Warugoni.
Yeah, I want to speak on the prevalence first.
Right.
Generally, the prevalence of chronic kidney disease from previous work in the country, between 6 to 10%, generally, most works are pointing towards that. What we found out in our own case is that we use dialysis as a surrogate, because if you want to really know the prevalence, you must go into the community. As I told you, a lot of the cases are asymptomatic. They may not have come to the hospital. So we use people attending dialysis for renal replacement, dialysis centers for renal replacement therapy as surrogate. And that's why we got the hotspots in those communities that you had earlier mentioned. Two, when you talk about in case at the end of the day you found out that it is this heavy metal, the method is that there is a reverse osmosis and other recommendations that can be made in the water so that those heavy metals, right from, like, if you sink a borehole, you use a reverse osmotic method, you filtrate and remove those heavy metals before humans will be able to consume it. These are all simple methods that can be used in case you arrive at a conclusion to prevent people from further being affected by these kidney ailments. Of course, lifestyle change for general possession of kidney disease. At the state level, dialysis in itself, in advanced countries, people live on dialysis for decades. And we are improving on that. We have people here who have been on dialysis for 5 years, for example. They are coming to the center to attend that. So it's a form of renal replacement therapy. Yes, it is sustainable, but with the state-owned health insurance, later on, perhaps there could be transition in which, people will be paying maybe 10% of the total cost, and government will be able to sustain such programs. As the transplant services is also a way of building the capacity of our healthcare workers, because even at the moment, we have centers in the country where kidney transplant is being done, but most of them are private and it's quite expensive. So we can do it at a public, this thing, you can train our healthcare workers, and such services can be rendered in the long run. Right. Because we solve this problem, that doesn't mean that kidney disease will cease to exist, because there are other causes which will continue to affect people, like hypertension, diabetes, and stuff like that. So because of that, you need to also continue with such services. We are not saying that when you discover the cause, you stop such services. No, it doesn't happen that way. I hope you do understand.
Yes, absolutely. So again, I want this message to hit home. Everyone watching right now, again, don't think that because you're not in Yobe State, you're not in Borno, Jigawa, you're not affected. Everybody eats some sort of meal. In fact, some of the fruits grown there can be brought to other parts of the country and you eat it. So I want this to be all hands on deck kind of approach. So, Doctor, give us some sort of recommendations. This is like free consultation. For those who may be asymptomatic, what should they look out for? What kind of diet should they be on? What kind of meals should they eat such that they can reduce either the prevalence, the impact, or just mitigate this? So this is a free consultation, Doctor.
Generally, as part of health promotion, people should come for regular checkup in the hospital. Check your blood pressure regularly, check your blood sugar level, you exercise. Some of these social vices like smoking, excessive drinking of alcohol and other things should be stopped, control of weight and so on. These are general measures to control most of these cardiovascular diseases as well as, kidney diseases. Then for those communities, as I've told you, a research is going on at the moment. It will be too early for us to say people stop drinking water or this thing. But since we have already commenced this research, we have done community advocacy level, we are at the planning level, soon we are going into the community. And I understand that at the other end, even in Jigawa, some work has been going on. So by the time, you tie the knots here and there, you'll be able to arrive at a conclusion. As I have told you, if it's due to heavy metals, there are solutions that could be recommended. If there are due to other causes also, equally there's going to be solutions. Mind you, the international working group that we are working with, especially those from the UK, United Kingdom, they are also working in Central America, in Southeast Asia, and even in East Africa, in which they found out excess of chronic kidney failure in agricultural communities. In some of those areas, they have identified things like pesticides, for example. In other areas, they couldn't still, put down their finger on one thing. So there are a lot of things that are going on. But as I can assure you, the state government is so committed. They have already given money for the research. And I'm sure in the not too distant future, we're going to arrive, at a conclusion, and then solutions will be proffered to those communities so that more lives could be saved, courtesy of the Yobe state government. Thank you.
Dr. Maina, free consultation of sorts, diets, lifestyle changes. What should we be looking at as a people generally so we can protect our kidneys and ensure that at least we stay alive for the good of family, ourselves, and the nation?
I just want to go back a bit to say that at the moment, we still cannot conclusively say that the food items or things being produced in those communities is bad. So we have to be a bit careful in making those interpretations. We have to wait until the research is concluded before we can make such conclusions. But overall, as a researcher and a scientist, I think for me, my consultation is more like to seek support from the community, to say that we are aware of what is going on, and with your support, we will find the root cause of this problem. But also to say that in addition to the funding that has been provided by the state government, like you rightly mentioned, kidney disease.
Dr. Muna, Dr. Menabuka, pardon me, just to be clear, this is from the preliminary findings that Professor Maimuna Waziri, the VC of Federal University, Geshua, Yobe State, spoke about. It's from the preliminary findings, where she talked about cadmium, lead, possibilities of that in water, cabbage, and the rest. So that is strictly from the preliminary findings, just to put that in context. Let's go ahead.
Fantastic. So, like I was saying, I think in like you mentioned, kidney disease is something that affects diverse population, not just Yobe, Borno, Jigawa, but other parts of the country, Africa, and the world. And we are glad that the government of Yobe State is providing the funding to allow us to start understanding this. But I would also like to encourage that this is something that will require, hello? Okay, this is something, but there is a need.
Dr. Mahmoud Mainabuka, thank you very much. I guess we have network issues from Abuja, but thank you so much, gentlemen. Dr. Baba Warugoni, the Chief Medical Director, Yobe State University Teaching Hospital, Damaturu. Thank you for your time on the program. And Dr. Mahmoud Mainabuka, the Honorary Special Advisor to Yobe Governor on Science, Research and Innovation, is also the team lead founder, Biomedical Science Research and Training Center, Yobe State University, Damaturu. Thank you very much, gentlemen, and we hope that the people and, of course, the government will do well to tackle this issue on kidney disease.